Hello, my name is Teresa, and today I would like to discuss about healthcare reforms. Accessible healthcare has been a constant struggle throughout American history. I would like to discuss a couple healthcare reforms that help expand healthcare to non-elderly adults in America and how this affects American social well-being and their overall life satisfaction. Also, how not having access to healthcare could negatively affect those. And how can us nurse leaders contribute to healthcare reform, expanding healthcare coverage for our patients, and what we could do to help them? A major healthcare reform happened in Massachusetts. It provided nearly universal healthcare coverage to everybody within the state in 2007. All residents had to have some sort of healthcare coverage or they were going to face a tax penalty. The largest insurance healthcare reform since the 1960s for the non elderly low income was the Patient Protection Act and the Affordable Care Act. The Affordable Care Act provided Medicaid to people that had a family income that was up to 138% of the federal poverty level. Supreme Court ruling in 2012 made Medicaid expansion optional for individual states. In 2014, the federal government fully funded the expansion, so more states were willing to expand on the Affordable Care Act. So there was a study that was conducted, the age groups from 18 to 64 years old is pertaining to life satisfaction, social well-being under the healthcare reforms of Massachusetts and Affordable Care Act. The data that was collected from the Behavioral Risk Factor Surveillance System, it was from the time period of 2005 to 2010, reveals that during the Massachusetts healthcare reform, the citizens had an increase of social well being and life satisfaction. And compared to the other states, Massachusetts had a higher life satisfaction. So, the panel study of income dynamics was used to collect data for the Affordable Care Act from the time period of 2009 to 2017. With Affordable Care Act implemented, there was a higher probability of people reporting that they were very satisfied versus not very satisfied with their life on the survey. The implementation of the Affordable Care Act after 2 years showed evidence that mortality declined among the low income adults and decrease in probability of depression was found among those who received Medicare coverage. An example of how not having access to healthcare coverage can affect its citizens is the disenrollment of Medicare users that happened in 2005 in Tennessee. The healthcare coverage was called TenneCare, and it became too expensive for the state to finance. This resulted in disenrollment of 190,000 Medicaid recipients. This left many uninsured, and consequently, it led to an increase number of evictions. Being uninsured causes reduced use of preventive care, poorly managed chronic illnesses such as mental health, and substance abuse. Poor health makes it difficult to work and support oneself, and indirectly causes a decrease in social well being. Reasons that access to health insurance increases life satisfaction is it provides the peace of mind for the unexpected health crisis and the costly expenditures that will come with it. It reduces stress and anxiety that is associated when you have to receive health care because of the financial burden. It lowers your out of pocket cost and it allows people to invest in their health maintenance. What nurse leaders can do is to get involved in health policy making on a hospital level and even national. The barriers that nurses face with getting involved in policy making is the lack of education surrounding around it. Only 1.9% of nurses hold a doctoral degree, and we should work on becoming more politically competent, know more about the health policies that we're working under like a hospital level and even state and national. Nurses see the disparities within healthcare, and we should have a voice to help create change within that system so we can become healthier as a society as a whole. And this is the list of my references. Thank you for watching. Have a great day.